In addition to the role that we serve at our academic institutions, it is expected and important for us to engage in various areas of scholarship. Boyer's scholarship model gives us the categories, which are also called dimensions, associated with the different types of scholarship. We have scholarship of discovery, integration, application, and teaching, and they are all equally important. Welcome back, everybody, to Dr. Sellers Educate. We are continuing to explore this really important topic as it relates to all of our nurse educator competencies, honing in on the scholarship of teaching. Billings and Halstead in the sixth edition, they actually have several different pages that describe various projects and processes associated with the scholarship model, Boyer scholarship model specifically. So on pages 8 through 10 in the sixth edition, as well as starting on page 539, is where you're going to see some descriptions of exactly what these different dimensions of scholarship entail. If you're on the journey to C&E, this is important information for you to understand. Specifically, you want to be clear about the examples associated with each dimension of scholarship. If your goal is to become a better nurse educator, it's always great for us to understand these dimensions as it relates to the work that we are doing, not only in our classroom, clinical area, skills lab, and SIM area, but also as it relates to the commitment that we're making to our professional organizations outside of our normal everyday work. The goal is that by being a part of these professional organizations such as NLN or AACN, that we are able to collaborate with other nurse educator colleagues that help us build a stronger nursing program and ultimately will help us be better nurse educators as well. We're going to be using Prezi as our platform in our content review today. And what we want you to do, as always, is to pull out your study worksheet. So print that out. That's listed right here in the description. And go ahead and pull out Billings and Halstead. Now, I know some of you may have the sixth edition. Some of you may have the new seventh edition. The sixth edition is what is currently used in 2024 to map the exam content. That was feedback from the NLN exam writers. And so that's why we're continuing to use the sixth edition. We also have the actual crosswalk between the sixth and seventh edition right here in the description. So, what exactly is SoTL, or the Scholarship of Teaching and Learning? It really allows us to bridge that theory practice gap. We've already talked about Boyer's dimensions of scholarship. How does it all relate? How do we put a nice bow on the scholarly work that we're doing in the classroom? We know that the clinical setting, there has to be that bridge of theory to practice in order for us to integrate evidence-based practices into the work that our students are doing. Well, that's exactly what SoTL is. It really defines and clarifies the work that we're doing as a scholar from the teaching level and from the actual application level. So we're going to talk about these key concepts. So first of all, getting a little bit deeper in defining what it is. We did an intro in the slide earlier. It refers to the systematic study of teaching and learning processes. When we talk about teaching and learning, it makes us think about Kolb's experiential learning theory. For those of you that may have a gap area, you can also use Billings and Halstead textbook. And if you want to turn in that book to this chapter 2, this is where you're going to see an introduction of the learning process that happens with our students. You're also going to see some key foundational elements in chapter 2 that really describes the role of teaching and our responsibility to help students learn. When you look at page 30, this is where you're going to see the Kolb model of experiential learning, as well as figure 2.2. So if you're not familiar with Kolb experiential learning theory, I encourage you to take a look there. But this is the part that we talk about as it relates to bridging that theory practice gap. It encourages us as educators to engage in research that is going to help improve the way that we create our learning experiences for our students. And it also allows us to engage our students in the learning process. We are gathering data about how our students are performing in the classroom. That's through discussions, right? We're gathering formative feedback. We're remediating our students so that we can help improve their outcomes. These are all examples of the SoTL work that each of us are doing with our classroom experiences every day. So what else is it that you want to focus on? Well, when we think about SoTL and the responsibility that we have, We like to also integrate a thought-provoking question. You all probably already knew that was coming. So let's take a look at this one and see what you think. 70 to 80% of the content on the C&E exam will be at that application and analysis level. This is why we engage in the thought-provoking question. Now, on the 7th edition, if you have that one, there is an online component to that 7th edition that includes exam questions or thought-provoking questions. Okay, so that's going to help familiarize you with the content that is already included in Billings and Halstead. And then if you have Dr. Caputi's C&E review book, the 2nd edition has the practice questions at the end of every chapter as well. All right, so let's take a look at this thought-provoking question. So as a nurse educator, you notice that a student consistently struggles with critical thinking during clinical decision-making scenarios. According to the principles of facilitating learner development, which of the following strategies is most effective in promoting the student's critical thinking skills? So I want you to think about, what is this question really asking me? And then what is it that I know for sure about this question? So the 3 options are: assign the student additional reading materials focused on evidence-based practice and ask them to summarize the key points. Option B, encourage the student to participate in a peer study group where they can observe and discuss clinical reasoning processes with their peers. Or C, provide immediate feedback during clinical simulations, guiding the student through reflective practice and questioning to explore alternative decision-making approaches. So think about, what is this question really asking me? And what is it that I know for sure? We want you to take the same approach when you get to the C&E exam. This is going to help decrease your anxiety and help you really see the question that is on your screen. Okay. And of course, if you have any questions about the thought-provoking questions or that we provide, or if you just want to take a deeper dive, reach out to us, info@drsellerseducate.com, and we'll be happy to provide additional context to help you clarify any muddy points that you have. So why does SoTL matter in nursing education? Well, it helps us enhance the quality of our teaching. It fosters that critical thinking and clinical skills for our students, and it helps us connect the dots with our students. The goal is that we're able to integrate this framework and these evidence-based strategies to help us improve the learning experience for our students. When we talk about reflective practice, this is a big part of our ability to engage students in a way that they're able to critically think. So they think about, what is it that I did today? What impact did my teaching strategies as an educator have to my students in a way that allowed learning to happen? Going back to Kolb's experiential learning theory, we enter the learning cycle based on Kolb's work when we actually have that practical experience, when we have that hands-on experience. So what that means is we want to be able to close the loop and connect the dots for our students. We do that through reflective practice. We have debriefing sessions with our students. We may even engage in a discussion right as part of our debrief with our students to allow them to think through the processes that were involved in that actual simulation or in that clinical experience, so that we can help clarify any muddy points that they have. Now, we all know there is a science to be able to do this effectively. So we want to engage in professional development to learn about the standards for simulation. As an example, if you are following a NACSL guidelines or whatever those evidence-based practices are, it's important as educators for us to sit in the seat as a learner as well. That's the first step in us helping to bridge that theory practice gap and to be able to role model these subtle practices that we are discussing. Okay, so what else is it that you want to focus on? Well, we also want to practice those reflective practices that we are talking about. This means that we're going to debrief after even our learning experiences that we've engaged with for our students. We want to determine, was it a success, or is there opportunities for us to improve the learning experiences that we've developed? Are we consistently using a blueprint, an exam blueprint for all of our exams? Are we developing a teaching plan so that we're clear about the content that we are teaching and how it maps back to our learning objectives, our assessment tools, and ultimately, how does that teaching strategy, how does that teaching plan support us achieving our program outcomes? What else is it that you want to look at? Well, you want to think about, how are my teaching strategies really affecting the learning process? Is it effective? Are there different approaches that I need to take? Is there development that I need to engage in? Going back to the Malcolm Knoll strategy, we are responsible for our learning. What does that mean? We want to do that self assessment. We want to have a clear understanding of where our gaps are. That's going to help us determine what adjustments we need to make in order for us to engage students in that effective learning experience. This allows us to engage in this continuous improvement. We know that there's always more to learn, right? As an educator, the best way to learn is through teaching. We get to learn twice, right? When we teach, we learn the content and then we learn about our students. We learn through teaching, through engaging in that collaborative practice, whether in the clinical setting or even in the didactic setting. Patricia Benner's work talks about our ability to engage in those clinical experiences starting in the classroom. Well, how do we do that? Well, we're prepared with advanced technologies, we are prepared with the content that we're going to teach, and we've already aligned it with the evidence based teaching strategies. Let me give you an example. When we talk about flipped classroom, we want to engage students in that learning process before they even arrive in the classroom. We want to assign a ticket to class or a pre-class assignment so students have an opportunity to review the content and they are already engaged in that learning process. So we are protecting that in-person time to clarify muddy points, to go into that deeper learning process where we can validate students' comprehension of these concepts. That's going to help build on those critical thinking skills and advance the utilization of clinical judgment. Well, in order for us to effectively do that, we've got to engage in this continuous improvement, this continuous learning process, just as Malcolm Knowles talks about. Our commitment as educators is to be lifelong learners, and it requires us to raise our hand, to speak up and advocate for what our needs are. Reflective practice, we want to role model that. We want to talk about it with our students. When we're thinking about what worked well with our previous class, what didn't work so well, we're gathering that data from our students, right? They have lots of feedback for us, and we want to use that feedback in a productive way so that we can increase the engagement with our students in the classroom and also increase the engagement in the learning, right? We want students to do some self actualization and to take some accountability for their learning in the process as well. This means that we're giving them formative feedback, we're making adjustments based on our reflection, and we are ultimately helping students increase their accountability in the learning process. Our ability to collaborate with other nurse educator colleagues, where we can practice sharing our knowledge, working together to improve our teaching strategies, being a peer mentor, engaging in peer evaluation is often a standard process that we follow. So, peer evaluation, where we have colleagues that are teaching in the same nursing program as we are, and they're giving us feedback about what they've observed, and we're making adjustments. Also, with our clinical partners, same thing. They're completing an evaluation. They're telling us continuously not only about how our students are performing post graduation and once they are in their facility, we get feedback that way, but we also get feedback through our clinical faculty, hearing about changes that are happening within that healthcare organization, and also making decisions about adjustments that we may need to make in our skills lab or even in our didactic setting when it comes to the content that we're teaching. All right, so as we wrap up, let's take a look. We've talked about those pedagogical techniques as well. Let's talk a little bit about what your next steps are going to be. So if you chose C as the correct answer, you are correct. So give yourself a round of applause. Providing this feedback during clinical simulations guides the student through that reflective practice and questioning to help them make more sound patient care decisions. The scholarship of teaching and learning is part of our responsibility as educators. Let's make sure that we have the support that we need to make improvements in our learning experiences for our students to help us be a better nurse educator. Reach out to us with questions, info@drsellerseducate.com. We'll see you next time.